My research interests are relate to physical activity and population health, and looking at theoretical strategies that can improve physical activity for the population across different sectors of our population, different target audiences in our population, and tailoring appropriate programs that are age and gender specific to promote healthy body weights. Some of our studies have looked at different modes of delivering physical activity programs. So do certain types of people prefer to receive information through telephone counseling, for example, through the internet, through paper-based mode of delivery? And so what we have found is that different modes of delivery might be more appropriate for certain types of the population. And in what combinations do people like to receive their information and their strategies? That was a series of studies have examined that. We've also targeted high-risk population groups, people who are conscious about coming out of their homes to do physical activity. So what we did in one study was to bring in fitness trainers and the equipment right into people's homes and train them for a number of months. And these were individuals who were quite obese, and indeed those results, soon to be published, were very encouraging that indeed people that the program was fairly effective. So trialing different strategies across our population groups to improve people's physical activity levels and ultimately their healthy body weights. Certainly physical activity is one of the key elements in the equation, along with healthy nutrition. And so focusing on physical activity with the balance of energy in and energy out certainly is a very important component of our strategies. And so both at the prevention and at the treatment side of obesity and also diabetes, which are closely linked. Some of the next steps, which will be, I've received some funding from the Canadian Institutes for Health Research. Their Applied Public Health Chair program has provided funding, infrastructure funding, to develop physical activity capacity in Canada, to build capacity across research, teaching, and knowledge translation for health practitioners. So what I have in mind is to continue along a series of research studies to examine different combinations and different approaches of physical activity strategies towards healthy body weights and general health of the population, but also to train the next generation of graduate students in this area through some innovative teaching modules, which will include public health practitioners and researchers working together, and in terms of knowledge translation, are to come up with innovative forms of how we can disseminate our findings to practitioners and to policymakers. So linking those three components, if you will, the research and the teaching and the knowledge translation. So the next 5 years of work will be working towards this integrated approach.